Hello everyone. Today in the subject of medical microbiology we are going to study about Mycobacterium tuberculosis. So the main objective of this lecture would be to give you a brief introduction about Mycobacterium tuberculosis and what are the causes of disease and prevention and cure that is caused by the disease that is caused by this bacteria. So Mycobacterium tuberculosis is a species of pathogenic bacteria in the family of Mycobacteriaceae and the causative agent of tuberculosis. So, tuberculosis is an infection that is caused in the lungs of human beings and animals. So, there are small tumors when the inside of the lungs are observed. That is why the name tuberculosis has been given. First discovered in 1882 by Robert Koch, Mycobacterium tuberculosis has an unusual waxy coating on its cell surface, primarily due to the presence of mycolic acid. So, it was first discovered in 1882 by Robert Koch when he was studying in his laboratory, and this bacteria colonies have unusual waxy coating, and that is the presence of mycolic acid that is present on it. This coating makes the cells impervious to gram staining, and as a result, Mycobacterium tuberculosis can appear either gram negative or gram positive. So, because of the mycolic acid that is present on the colonies of Mycobacterium and gives them a waxy appearance, okay, and waxy coating, and because of this the classification of gram staining and the staining protocol is somewhat not properly applicable to this bacteria, and sometimes either it shows the characteristics of gram negative bacteria, and sometimes it can also show the characteristics of gram positive area positive bacteria. So it is somewhat variable when it comes to gram staining. So what we have learned here is Mycobacterium tuberculosis was first discovered in 1882 by Robert Koch. It is a pathogenic bacteria of Mycobacteriaceae family, and it produces tuberculosis in the lungs of its victim. And when they are cultured in the laboratory, these cultures do have a waxy coating on them because of the presence of mycolic acid, and this is the main reason that gram staining does not properly work on the Mycobacterium tuberculosis. Acid fast stains. As see in this picture, you can see the waxy appearance of the colonies of Mycobacterium. In this image, you can clearly see, and this is due to the mycolic acid they produce. So, acid-fast stains such as Nelson or fluorescent stain, such as ornithine, are used instead to identify Mycobacterium with a microscope. So, instead of identifying it via microscope, acid-fast stains are used because this bacteria does not readily um, shows its compatibility with gram staining. So acid-fast stains has been developed in order to stain the Mycobacterium tuberculosis properly. So Zell-Nelson, uh, a fluorescent stain such as oromine are usually used for the identification purpose. instead of identifying it on the basis of microscopical studies. The physiology of Mycobacterium tuberculosis is highly aerobic and requires high levels of oxygen. So, one can very easily understand this fact because Mycobacterium tuberculosis is constantly uh, infecting the lungs of the individuals. Okay, so when it is always infecting the lungs of the individual, it does require a very high levels of oxygen and constant supply of oxygen. So, primarily a pathogen of the mammalian respiratory system, it infects the lungs. The most frequently used uh, diagnostic method for tuberculosis are tuberculin skin test, acid fast stain, culture, and polymerase chain reaction. So here what we see that when it comes to the physiology, the working scenario of Mycobacterium tuberculosis, it is highly aerobic in nature. Okay, it requires very high amount of oxygen for its survival and working, and as a result requires a very high amount of oxygen, and primarily a pathogen of mammalian respiratory system. It infects the lungs. So its main target is your respiratory system or lungs. And most frequently used method for diagnostic purposes is tuberculin skin test, acid fast stain, culture, and PCR. The Mycobacterium tuberculosis genome was sequenced in 1998. So now we completely understand this bacteria of Mycobacterium tuberculosis and how does it behave, what are the weaknesses it has, and how we can overcome it. So, Mycobacterium tuberculosis. Here you can see the diagrammatic representation. Waxy cell wall from mycolic acid and acid fast staining is used to identify. Generally, it is rod shaped and it has a character that needs oxygen uh, strict aerobe. So, it requires a lot of oxygen to survive in the environment. So Zell-Nelson stain or acid-fast stain, when it stains the Mycobacterium tuberculosis, it stains them bright red. Microbiology. Mycobacterium tuberculosis was found in 2019, a complex that has at least 9 members. Mycobacterium tuberculosis sensu, stricto, Mycobacterium africanum, Mycobacterium caneti, Mycobacterium bovis, Mycobacterium uh, capri, Mycobacterium microti, Mycobacterium uh, penni, pedi, Mycobacterium mungi, and Mycobacterium orgis. So it has 9 family members that are present around the world, and this family is really very versatile. It requires oxygen to grow. It is debated whether it produces spores and is non-motile in nature. So it is debated that this particular bacteria produces spores when it arrives into mm, the conditions that are not favorable and is basically non-motile in nature. It cannot move around very quickly. Mycobacterium tuberculosis divides every 18 to 24 hours. So it has a division rate of 24 hours. Within the time period of 18 to 24 hours, it will double itself. This is extremely slow compared with other bacteria, which tend to have division times measured in minutes. like E. coli can divide roughly every 20 minutes. So, when these bacteria they do have favorable conditions, when they do have uh, a lot of food and all the things that are supplied essential for the metabolism in bulk, they tend to divide and they tend to multiply every 18 to 24 hours. Although it is very slow, in the case of some of the bacteria like E. coli, it divides roughly after every 20 minutes. It is a bacillus that can withstand weak disinfectants and can survive in a dry state for weeks. So, due to its waxy coating, it does have many advantages that it can withstand weak disinfectants and can readily survive a dry state for several weeks. It is unusual. Cell wall is rich in lipids such as mycolic acid, is likely responsible for resistance to desiccation and is a likely virulence factor. So, this unusual cell wall that is rich in lipids and mycolic acid is extremely lethal, and most probably it is responsible for resistance to desiccation that comprises under the virulence factors of which enables it to cause many diseases. Culture. Mycobacterium tuberculosis can be grown in laboratory. Compared to other studied bacteria, Mycobacterium tuberculosis has a remarkably slow growth rate, doubling roughly once per day. Commonly used media includes liquids such as Middlebrook 7H9 and 7H12, egg-based solid media such as Longstein and Jensen, and solid agar-based such as Middlebrook 7H11 and or 7H10. Visible colonies require several weeks to grow on agar plate. It is distinguished from other mycobacteria by its production of catalase and niacin. So, although this bacteria is very slow growing, when it is cultured properly on agar plate, it takes several weeks to grow a visible colony because it is a very growing pathogen. So, other tests to confirm its identity include gene probes and Malditorf. When a person breathes in TB bacteria, the bacteria can settle in the lungs and begin to grow. From there, they can move through the blood to other parts of body, such as kidney, spine, and brain. TB disease in the lungs or throat can be infectious. This means that bacteria can spread to other parts to other people. TB is in other parts of the body, such as kidney or spine, is not usually infectious. People with TB disease are most likely to spread it to the people they spend time with every day. This includes family members, friends, and co-workers or schoolmates. So, most importantly, what they are trying to explain to you is that um, the TB bacteria prefers the environment of the lungs, and once it settles down, it begins to grow, and from there it will proliferate to other parts of the body via blood, such as kidney, brain, and spine. And TB disease in the lungs or throat can be infectious. This means that the bacteria can spread from to other people from a single individual. TB in other parts of the body is not that much harmful as it is compared to lungs. So people who are suffering with TB are more likely to spread it to the individuals who remain in their close contact. So how TB spreads? What are the mechanisms? TB bacteria are spread through the air from one person to another. The TB bacteria are put into the air when a person with TB disease of the lungs or throat coughs, uh, speaks, or sings. People nearby may breathe in these bacteria and become infected. So, when an individual is suffering from TB uh, bacteria, and mainly this bacteria targets your lungs, and in this scenario, the person is breathing and sitting in close contact with other people, and it is basically a disease of lungs and throat. So, if a person coughs, speaks, or sings, the indirectly the people nearby will breathe these bacteria in their own lungs. So, one has to be extremely careful when you are dealing with such scenarios, when you are dealing with the individuals infected with TB. TB is not spread by shaking someone's hand, sharing food or drink, touching bed lines or toilet seats, sharing toothbrushes, or kissing. TB risk factors. So, what are the risk factors that are included in tuberculosis infection? Some people develop TB disease soon after they become infected within weeks. So, TB disease is developed within weeks when the individual is infected before their immune system can fight the TB bacteria. Other people may get sick years later. Okay, and they can get very sick after several years of getting TB infections, or other people can get within weeks of getting infected. Their immune system starts to fight the bacteria. When their immune system becomes weak for another reason, bacteria try to take over the body. So it is a funny fact that 80% of the Indians are potentially suffering from TB bacteria, although it is asymptomatic, but they do have TB bacteria in their bodies. So, although it is present in 80% of the Indians, but it only affects the individual who has become weak or whose immune system is not at all up to the mark. He or she has become a really very weak or immunocompromised person or individual. Overall, about 5 to 10% of infected persons who do not receive treatment for latent TB infection will develop TB disease at some times in their life. So, if the individual is not at all receiving treatment for latent TB infection, then they are more likely to receive some kind of TB infection. For persons whose immune system are weak, especially those with HIV infection, and the risk of developing TB disease is much higher than for person with normal immune system. So this Mycobacterium tuberculosis searches for the individuals who are weak, whose immune systems are not up to the mark. So when the individual becomes weak, they immediately attack the person. Generally, persons at risk for developing TB fall into two categories. And what are those categories? Persons who have been recently infected with TB bacteria, persons with medical condition that weakens the immune system. So here you can see Mycobacterium tuberculosis or TB testing for patients with symptoms. The testing is done by sputum, bronchoalveolar lavage. Symptoms include fever, night sweats, weight loss, coughing up blood, and hemoptysis. Samples are sent to lab for staining culture and PCR. Persons who have been recently infected with TB bacteria, this includes close contact of a person with infectious TB disease, person who have immigrated from areas of the world with high rates of TB, children less than 5 years of age who have a positive TB test, groups with high rates of TB transmission, such as a homeless person, injection drug users, and person with HIV infection. So, a person who work or reside with people who are at risk for TB in facilities or institutions such as hospitals, homeless shelters, correctional facilities, nursing homes, and residential homes for those with HIV. Persons with medical conditions that weaken the immune system. Babies and young children often have weak immune systems. Other people can have weak immune systems too, especially people with any of these conditions. And what are those conditions? If we observe them carefully, other people can have weak immune system too, especially uh, with any of these conditions, like HIV infection, human immunodeficiency virus, the virus that causes AIDS, or acquired immunodeficiency syndrome. Substance abuse, the individual is addicted to some alcohol or drug. Silicosis, when the individual is working in uh, unsafe environment and he may inhale some substances that will cause silicosis of the lungs. Diabetes mellitus, you know that when pancreas are not working properly. Severe kidney disease of any kind. Lower body weight, low body weight. The body weight is very low, and the individual is underweight. Organ transplant, these are the things that come under xenografting, and when the individual has received some sort of organ transplant. Head and neck cancer. Medical treatments such as corticosteroids or organ transplant, specialized treatments for rheumatoid arthritis or Cohen's disease. So, Mycobacterium tuberculosis, immune system compromised individual, AIDS or aging, that they have the condition, spreads in to upper lobes. Oxygenation is the greatest advantage that it usually explores. Memory T cells release cytokines, and T cells they try to release cytokines in order to protect themselves. More seizures, necrosis, and causes cavities. TB decimates and spreads. So on gone focus plus lymph nodes, gone complex is superior and lower lobes. So in a very simple manner, they are explaining that the tuberculosis infection starts from the upper part of your respiratory system and then spreads towards the lower part of your respiratory system. Vaccines. So when the TB disease is not very new, Okay, every individual know about TB disease and how it is caused and why it is caused and what are the scenarios that are essential to take uh, to cure and to make individual happy, right? And dealing with TB disease is extremely important in our country because it is preventable if it is properly uh, diagnosed and treated, and treatment is received properly. So, TB vaccine, BCG, uh, Bacilli calmant urine, the TB vaccine of for tuberculosis diseases. This vaccine is not widely used in United States, but it is often given to infants and small children in other countries where TB is common. BCG does not always protect people from TB. Although small children or young children or infants, they are given the BCG vaccine on regular basis in the country where TB is very common. BCG recommendations in the United States, BCG should be considered only very select people who meet specific criteria and in consultation with a TB expert. Healthcare providers who are considered uh, who are considering BCG vaccination for their patients are encouraged to discuss this intervention with TB control program in the area. So nowadays the BCG is being considered for the areas where tuberculosis is much more frequent. And here you can see the diagrammatic representation, how the bacteria enter inside a new host, multiplication in the niche, infection of individual macrophages, expansion in innate granulomas, granuloma maturation takes place, and lymphocytes are all around it. Granular necrosis with extracellular replication. Then it comes out of the granuloma cells, and then the transmission again takes place to other individuals. Children. BCG vaccination should be considered for children who have a negative TB test and who are continually exposed and cannot be separated from adults who have TB, are untreated or ineffectively treated for TB disease, the adults, and the children cannot be given a long-term temporary prevention treatment for TB infection. Have TB disease caused by strains resistant to isoniazid and rifampin. So here you can see the diagrammatic representation of innate immunity, no detectable T cell priming like macrophages, NK cells, beta deficients, neutrophils, gamma and T cells, cathedicillins, clearance of infection, to 50% more exposed persons have no immune diagnostic evidence of MTB, Microbacterium tuberculosis, sensitization, and may remain uninfected through sterilizing immunity. So this all elaboration is taking place under the alveolar uh, pneu- pneumocytes or pneumocytes. Adaptive immunity, evidence of T cell priming. So T cell then comes into contact with macrophages. CD4 native cells come into contact with T cells, and there's some exchange of information with CD8 native cells, perforin and granulosin. Then it leads towards the action of CD8 cells, and CD4 cells also are also produced. Then cytokines are produced in a response. The Th1, Th2, and Th17 CD4 cells are formed, and they are readily present in us inside the alveolar pneumocytes. So, the reinfection or reversion of TST or IgRA, acute or chronic resolved infection, LTBI or clinically detachable, active or subclinical disease. In 95% containment, -2 to 5%. The remainder of exposed person have conversion of TST or IgRA, and a proportion have presumed infection. So, uh, less than 50% or more exposed persons have no immunodiagnostic evidence of Mycobacterium tuberculosis, and close contact and inhales the individual's Microbacterium tuberculosis. Healthcare workers. BCG vaccinations of healthcare worker should be considered on an individual basis in a setting in which high percentage of TB infected patients are with TB strain restrained to both ionized and rifampin. There is ongoing transmission of drug resistance TB strains to healthcare workers, and subsequent infection is likely. Comprehensive TB infection control precautions have been implemented but have not been successful. Healthcare workers considered for BCG vaccination should be counseled regarding the risks and benefits associated with both BCG vaccination and treatment of latent infection. So here you can see how Mycobacterium tuberculosis spreads in the alveolus, and phagocytes are present there, alveolar macrophages, monocytes and dendritic cells, and this Mycobacterium is entering inside it. Then alveolar space, uh, epithelial cells and lungs parenchyma, and this granuloma enters inside, and there we have intestinal macrophages also. Now, granuloma formation that takes place like T cells and B cells are constantly fighting the infection. Cellular granuloma form, and necrotic granuloma is as a result of the bacteria. Testing for TB and BCG vaccinated people. Many people born outside of United States have been BCG vaccinated. People who were previously vaccinated with BCG may receive a TB skin test to test for TB infection. The vaccination with BCG may cause a positive reaction to a TB skin test. A positive reaction to TB skin test may be due to the BCG vaccine itself, or due to infection with TB bacteria. TB blood test, unlike the TB skin test, are not affected by prior BCG vaccination and are not expected to give false positive results. People who have received BCG for children under the age of 5, the TB skin test is preferred over TB blood tests. A positive TB skin test uh, for TB blood test only tells that a person has been infected with TB bacteria. It does not tell whether the person has latent TB infection or has progressed to TB disease. Other tests such as chest X-ray and a sample of sputum are needed to see whether the person has TB disease. So, Mycobacterium tuberculosis microdiversity. In in vivo drug antituberculum treatment at diagnosis variant 1, you can see variant after 2 months of treatment, variant 2, variant 3, variant 4 and 5. In vitro mimicking course of TB disease. Antibiotic exposure of variant 2, variant 3, variant 4 and variant 5 VIMA that leads towards host cell infection, variant 2 and variant 3, and variant 4 and variant 5. So here are some TB terms that you must understand. TB disease, an illness in which TB bacteria are multiplying and attacking a part of the body, usually the lungs. The symptoms of TB disease include weakness, weight loss, fever, no appetite, chills, sweating at night. Other symptoms of TB disease depend on where in the body the bacteria are growing. If TB disease is in the lungs, pulmonary TB, the symptoms may include a bad cough, pain in chest, or coughing up blood. A person with TB disease may be infectious and spread TB bacteria to others. BCG, a vaccine for TB named after a French scientist who developed it, Calment and Guerin. BCG is rarely used in the United States, but it is often given to infants and small children in other countries where TB is very common. Chest X-ray, a picture of the inside of chest. A chest X-ray is made by exposing a film of X-ray that passes through the chest. Doctor can look at this film to see whether the bacteria have damaged the lungs or not. Contact, a person who spent time with a person with infectious TB. Culture, a test to see whether there are TB bacteria in your phlegm or other body fluids. This test can take 2 to 4 weeks in most laboratories. Directly observed therapy (DOT), a way of helping patients take their medicine for TB. If you get DOT, you will meet with the healthcare worker every day or several times in a week. You meet at a place you both agree on. This can be TB clinic, your home or work, or any other convenient location. You will take your medicine while the healthcare worker watches. Extensive drug resistance TB XDRB XDR-TB. XDR-TB is a rare type of TB disease that is resistant to nearly all medicines used to treat TB. So, laboratory diagnosis of Mycobacterium tuberculosis infection is done by acid-fast bacilli, Mycobacterium stained with fluorescent stain, monox tuberculin skin test, Mycobacterium colonies in algae medium, or gene expert MTB-RIF assay. Extrapulmonary TB. TB disease in any part of the body uh, other than the lungs, for example, the kidney, spine, or brain, or lymph nodes. HIV infection. Infection with human immunodeficiency virus, the virus that causes AIDS. A person with both latent TB infection and HIV infection is at high risk for developing TB disease. Isoniazid, a medicine used to prevent TB disease in person who have latent TB infection. Uh, INH is also one of the four medicines often used to treat TB disease. Latent TB infection, a condition in which TB bacteria lives but inactive in in the body. People with latent TB infection have no symptoms but feel sick, cannot spread TB to others, uh, and usually have a positive TB skin test or positive TB test reaction. But this may develop TB disease if they do not receive treatment for latent TB infection. Multi-drug resistance tuberculosis or MDR-TB. TB disease caused by bacteria are resistant uh, the two of the most important medicine, INH and RIF. Mycobacterium tuberculosis, the bacteria that cause latent TB infection and TB disease. Negative usually refers to the test results. If you have a negative skin test reaction or negative TB blood reaction, you probably do not have TB infection. Positive usually refers to a test results. If you have a positive skin test reaction or a positive TB blood test reaction, you probably have TB infection. Pulmonary TB, the disease that occurs in lungs, usually providing on producing a cough that lasts for 3 weeks or longer. Most TB diseases are pulmonary in nature. Resistance bacteria, bacteria that can no longer be killed by certain medicines. RIF, one of the four medicines used to treat TB disease, it is considered a first line of drug. RPT, one of the two medicines used to treat latent TB infection. Smear, a test to see whether there are TB bacteria in your phlegm. To do so, uh, to do this test, lab workers smear phlegm on glass slide, uh, stain the slide with a special stain, look for any type of bacteria on slide. This test usually takes 1 day long to get the result. Sputum, phlegm coughed up from deep inside the lungs. Sputum is examined for TB bacteria using a smear. Part of the sputum can also use to do culture. TB blood test, a test that uses blood sample to find out if your blood is blood if you are blood infected with TB bacteria. The test measures the response of TB protein when they are mixed with your small amount of blood. TB disease is an illness in which TB bacteria are multiplying and attacking a part of body, usually the lungs. The symptoms of TB disease include weakness, weight loss, fever, no pain, no appetite, chills, and sweating at night. Other symptoms of TB disease depend on where in the body the bacteria are going. If TB disease is in lungs, the symptoms may include a bad cough, pain in chest, coughing up blood. A person with TB disease may be infectious and spread TB bacteria to others. TB skin test. A test that is often used to find out if you are infected with TB bacteria. A liquid called tuberculin is injected under the skin or of lower part of your arm. If you have a positive reaction to this test, you probably have TB infection. Your test will needed to find out if you have latent infection or TB disease. Tuberculin PPD, a liquid that is injected under the skin or on the lower part of your arm during TB skin test. If you have latent TB infection, you will probably have a positive reaction to tuberculin. Latent TB infection and TB disease. Not everyone infected with TB bacteria becomes sick. As a result, uh, two TB-related conditions exist: latent TB infection and TB disease. TB bacteria can live in body without making you sick. That is called latent TB infection. Most of the people who breathe in TB bacteria and become infected, the body is not able to fight the bacteria to stop them from growing. People with latent TB infections have no symptoms, don't feel sick, cannot spread TB bacteria to others, usually have a positive skin test, a reaction, or positive TB blood test. So they may develop TB disease if they do not receive treatment for latent TB infection. Many people have latent TB infection, neither develop TB disease. In these people, the TB bacteria remain inactive for lifetime without causing disease. But in other people, especially people who have a weak immune system, the bacteria becomes active and multiply, causing TB disease. TB disease becomes active if the immune system cannot stop them from growing. When TB bacteria are active, multiplying in your body, this is called TB disease. People with TB disease are sick. They may also be able to spread the bacteria to people they spend time with every day. Many people who have latent TB infection never develop TB disease. Some people develop TB disease soon after becoming infected within weeks, before their immune system can fight the TB bacteria. Other people may uh, get sick years later when their immune system becomes weak for another reason. For people whose immune system are weak, especially those who have HIV infection, the risk of developing TB disease is much higher than of people with normal immune system. Differences between latent TB infection and TB disease. So, latent TB infection, a person has no symptoms. The person with TB disease has symptoms: bad cough that lasts for 3 weeks or longer, pain in chest, coughing up blood or sputum, weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night. Latent TB infection does not feel sick, and TB infection usually feels sick. Cannot spread TB bacteria to others, may spread TB bacteria to others. Usually has skin test or blood test results indicating an TB infection. Usually has a skin test or blood test resulting in indicating TB infection. has a normal chest X-ray and a negative sputum smear, may have abnormal chest X-ray or sputum smear or culture, needs treatment for latent TB infection to prevent TB disease, and needs treatment for TB disease. Exposure to TB. You may have been exposed to TB bacteria if you spend time with someone near someone with TB disease. The TB bacteria are put into the air by a when a person with active TB disease of the lungs or throat, coughs, sneeze, speaks, or signs. You cannot get TB from clothes, drinking glass, uh, eating utensils, handshake, toilets, or other surfaces. If you think you have been exposed to someone with TB disease, you should contact your doctor or local health department about getting a TB skin test, especially TB blood test. Be sure that to tell your doctor and or nurses when you spend time with the people who has TB disease. It is important to know that person who is exposed to TB bacteria is not able to spread bacteria to other people right away. Only persons with active TB disease can spread bacteria to others. Before you would be able to spread TB to others, you would have to breathe in TB bacteria to become infected. Then the active bacteria would have to multiply in your body and cause active TB disease. At this point, you could classify possible spread TB bacteria to others. People with TB disease are more likely to spread bacteria to people they spend time with uh, every day, such as family members, friends, co-workers, and schoolmates. So some people develop TB diseases soon, within weeks after becoming infected, because their immune system can fight TB bacteria. Other people may get sick years later when their immune system becomes weak. Another reason, many people of TB infection never develop TB disease. Signs and symptoms. What we have here are TB bacteria usually grows up in lungs. TB disease in the lungs may cause symptoms such as a bad cough that lasts for 3 weeks or longer, pain in the chest, coughing up blood or sputum. Other symptoms of TB disease are weakness or fatigue, weight loss, no appetite, chills, fever, sweating at night. Symptoms of TB disease in other parts of the body depends on the area affected. People who have latent TB infection do not feel sick, do not have symptoms, and cannot spread TB to others. TB preventions. Uh, Preventing latent TB infection from progressing to TB disease. Many people who have latent TB infection never develop TB disease. But some people have latent TB infections are more likely to develop TB disease than others. Those are at higher risk of developing TB disease include people with HIV infection, people who became infected with TB bacteria in at least last 2 years, babies and young children, people who inject illegal drug, people who are sick with other disease that weakens the immune system, elderly people, people who were not treated correctly for TB in the past. If you have latent TB infection and you are in one of these high risk groups, you should take medicine and keep from developing TB disease. There are several treatment options for latent TB infection. Because there are less bacteria, treatment for latent TB infection is much easier than treatment for TB disease. A person with TB disease has a large amount of TB bacteria in the body. Several drugs are needed to treat the TB disease. So always prevent exposure while you are traveling to such places. And if you are traveling to hospitals, prisons, and then you have to take extreme precautions. Multi-drug resistance (MDR), extensive drug resistance (XDR), TB are occurring globally. They are still rare. HIV-infected travelers are at great risk if they come in contact with a person with the MDR or XDR TB. Air travel itself carries a relatively low risk of infection with TB of any kind. Travelers who will be working in clinics, hospitals, or other healthcare settings where TB patients are likely to be encountered should consult infection control or occupational health experts. They should ask about administrative and environmental procedures for preventing exposure to TB. Once those procedures are implemented, additional measures could be uh, included using personal respiratory protective devices. So, MCQ: the causative agent of tuberculosis is bacterium. The person who discovered Mycobacterium tuberculosis was Robert Koch. Which of these is the culture medium for Mycobacterium tuberculosis? L- Lowenstein and Jensen medium. For tuberculosis, the drugs used to combat it are C. Streptomycin, pyrazinamide, isoniazid, or and rifampicin. The BCG vaccine is administered for immunity against B. Tuberculosis. A combination of medications which are applied to treat tuberculosis are both A and C to generate better response to decrease the resistance of entry to the treatment. This is the reason why diagnostic tuberculosis is turning challenging. Disease takes years to become active. The causative of tuberculosis produces tuberculin. It is an uh, endotoxin. This is the main symptom of tuberculosis. Tuberculin formation in the lungs. Diagnosis of tuberculosis is done by uh, emulator and antiforminin method, concentration method, Petrov method, and all the above. The correct answer is all the above. These are the references from where we have collected the material. And thank you very much for listening to my lecture.